Alrighty, we are recording. So my name is Lexi Graham, and I'm doing a 6-part video series on prone positioning and the ARDSNet protocol. And this is for special projects, respiratory for 2480. And let's get started. Video 1, we're just going to talk about pulmonary circulation to get a feel of how the blood flows through the body and through the lungs and the heart. So first, you're going to start at the vena cava, go to the right atrium, and then through the tricuspid valve into the right ventricle, and then through the pulmonary valve into the pulmonary arteries to the lungs. Then from the lungs, it goes to the pulmonary veins, to the left atrium, through the bicuspid valve into the left ventricle, through the aortic valve into the aorta, and then out to the body's tissues. So that's just a pretty simple flow chart of how blood gets to the body, deoxygenated being blue and oxygenated being red. Acute respiratory distress syndrome is what we're going to talk about first, or I guess second. When someone has developed ARDS in their alveoli, which are the tiny air sacs in the lungs, they become filled with excess fluid, preventing them from properly filling with air and exchanging oxygen, resulting in a lack of oxygen in the bloodstream due to the damaged lung tissue. In the early stages of ARDS, fluid from the smallest blood vessels in the lungs start to leak into the alveoli. The lungs become smaller and stiffer, and it becomes harder to breathe. And the amount of oxygen in the blood falls. This deprives your organs of the oxygen they need to thrive. This disease affects thousands every year. Prone positioning. The main goal of prone positioning is to improve oxygenation, respiratory mechanics, alveolar inflation and ventilation distribution, increase lung volume, reduced atelectatic regions in the lung, facilitate drainage of the lungs, and then also reduce ventilator-associated lung injuries. Patients with ARDS are the primary group who benefit from prone positioning, as it helps improve their oxygenation by redistributing lung aeration and reducing pressure on the lungs when lying on their stomach. So especially when they are on a ventilator and experiencing severe breathing difficulties, this will be helpful to them. Prone positioning has also shown to have some positive effects on hemodynamic implications, but we will talk about later on in this video series. And that was all. Thank you.